Hello, I'm Dr. Robert Milne, and I thank you for your interest in microvibration therapy. I'm a board-certified family practitioner and have been practicing integrated medicine for over 30 years. And over these years, I've tried many medical devices to help my patients, including TENS units, ultrasound therapy, acupuncture, and even had to resort to using drug medications at times. In my years of practice, I've never seen a device that relieved discomfort and pain in 2 to 5 minutes. In my opinion, the MVT relief device is one of the most exciting technological developments to come along to help people relieve their discomfort, stress, and pain. This media introduction will provide you with an overview of microvibration therapy. Now I would like to tell you a little bit more about how the MVT device was developed. A few years ago, my engineer friend Walter Spar and I were working on various electronic medical projects. One particular device caught our attention when one of my patients who suffered from severe low back pain was relieved of her pain within 2 to 3 minutes. I was very surprised by those results. And so over the next year or so, I treated many more patients with the device and realized that this was one of the most remarkable devices for pain relief. Over the next couple of years, we kept improving the device until we are now ready to share this discovery with you and other professionals and patients. The MVT relief device is a breakthrough in non-invasive electronic technology that uses a patent-pending combination of tuned low-level light, high-frequency acoustic sound, and microvibration that works synergistically to rapidly relieve many types of discomforts and pain. We have used the MVT device with hundreds of patients with remarkable results and heretofore have not responded to other modalities. While there are many devices out there that use one or more similar technologies, it is this synergistic, tuned combination of these technologies that has proven to be so remarkably effective. I'm very pleased that you have an interest in using the MVT relief device, and I look forward to hearing from you and your patients regarding your experience using it.
Please read the MVT booklet to give you an overview of the device. As you open the box, you will see the device, the topical energy conduction gel, and extra AA batteries. Unscrew the back of the MVT device and remove the batteries as demonstrated. Place new AA batteries with the plus side into the battery compartment. Twist the back end until it stops. Your MVT device is now ready for use. Turn on the MVT by pushing the silver button as demonstrated. You will see 3 LED lights. Also, listen to the sound. It should be clear. And finally, you should feel a mild microvibration on your skin when you apply it. Before use an alcohol swab to clean the device. Also, after many weeks of use, you may want to polish your device with a small amount of metal polish to keep it working at its optimum capacity. The extraordinary discomfort and pain-relieving effects of the MVT device are best utilized in conjunction with the ancient healing art of acupuncture or acupressure. Key points on the body surface called acupuncture points can be used to stimulate cellular communication and energy flow. Remember to apply the MVT device to the pressure points for at least 1 to 3 minutes to get the most out of the therapy. Apply the MVT to the large intestine 4, located in the webbing between the thumb and index finger. It relieves arthritis, digestive problems, headaches, toothaches, shoulder pains, and all upper body joint and muscle pain. Apply the MVT to the governing vessel 24.5, located between the eyebrows in the indentation where the forehead and nasal bridge meets. This balances the endocrine system, especially the pituitary gland. The next point is gallbladder 20, located below the base of the skull in the hollows on both sides of the neck. It relieves pain in all areas of the body, throbbing headaches, dizziness, stiff neck, coordination problems, and irritability. The next point is governing vessel 16, located in the middle of the lower back of the head under the base of the skull. It relieves pain in the eyes, ears, nose, and throat. It also relieves headaches and stiff neck. For lower body discomfort, apply MVT to gallbladder 20. Then apply MVT to stomach 36, which is 4 finger breadths below one kneecap, 1 finger breadth to the outside of the shin bone. Start on the right side for 1 to 2 minutes, then change to the left side. Next, apply the MVT to kidney 3 on the inside of the left ankle for 1 to 3 minutes. Then apply the device to bladder 60 on the outside of the ankle opposite kidney 3. If you have 2 units, you can place them across from one another for more relief. For head and pain discomfort, start with gallbladder 20. Then apply MVT to governing vessel 16. Then go to bladder 2, which is located in the indentation on either side of where the bridge of the nose meets the ridge of the eyebrows. This relieves headaches, eye pain, hay fever, eye fatigue, sinus pain, and facial paralysis. Then apply again to governing vessel 24.5. An additional benefit of this pressure point is that it helps to relieve blood pressure problems. Next, go to stomach 3, located at the bottom of the cheekbone below the pupil. It benefits sinus headaches, nasal and frontal congestion, eye strain, and toothaches. Again, apply MVT to large intestine 4, located in the webbing between the thumb and index finger. Next, apply MVT to liver 3, located on the top of the foot in the valley between the big toe and the second toe. This relieves headaches, foot cramps, eye fatigue, allergies, and arthritis. The next point will be gallbladder 41, located on the top of the foot 1 inch above the webbing of the 4th and 5th toes in the groove between the bones. This relieves headaches, arthritic pains, sciatica, hip pain, and shoulder tension. For additional pain relief, apply the device to each one of the toes and to the bottom of the foot as seen here. To relieve jaw and TMJ pain, start with conception vessel 24. This is located in the groove on the middle between the lower lip and the tip of the chin. This benefits jaw pain, toothache, and facial pain. The next point is stomach 6, located between the upper and lower jaw on the masseter muscle that bulges when the muscles are clenched. This relieves jaw pain, ear pain, throat swelling, toothaches, and facial spasms. Then go to small intestine 19, which is directly in front of the ear, and then back to gallbladder 20. For neck discomfort, we're starting with bladder 10, located 1/2 inch below the base of the skull on the ropey muscles 1/2 inch out from the spine. This relieves stress, sore throat, and stiff neck. Next, go to gallbladder 20 and apply to both sides of the neck. The next point is triple heater 16, located in the indentation at the base of the skull, 1 to 2 inches behind the earlobe, behind the mastoid process. This relieves stiff neck, shoulder, and neck pain and headaches. Then go to governing vessel 16, which is good for all problems of eyes, ears, nose, and throat. The next point is governing vessel 14, located on the back of the neck between the 7th cervical and 1st thoracic vertebrae. This relieves stiff neck, shoulder and back pain, lung problems, asthma, emotional stress, and fever. Again, go to large intestine 4, and then go to small intestine 3 on the crease formed by making a fist on the edge of the hand below the little finger. If you have two devices, they can be applied as seen here for additional pain relief. For shoulder discomfort, apply MVT to triple heater 15, located on the shoulders midway between the base of the neck and the outside of the shoulders, 1/2 inch below the top of the shoulder. This relieves shoulder muscular tension, stiff neck, and pain. Next, apply MVT to gallbladder 21, located on the highest point of the shoulder between the neck and the shoulder. This relieves stiff neck, irritability, shoulder tension, and poor circulation. And then to governing vessel 14, which is an important governing point, which also helps to relieve emotional stress. If you have two devices, you may apply them to the pressure points as demonstrated here for additional shoulder pain relief. For hand and wrist pain, apply the MVT to pericardium 6, which is located in the middle of the inside of the wrist crease between the ligaments. It relieves wrist pain, carpal tunnel syndrome, joint pains, and wrist tendinitis. The next point is located at pericardium 7, on the same side as 6, in the hollow of the center of the wrist at the crease. This point also strengthens the wrist. The next point is triple heater 4, located on the opposite side of pericardium 7, in the hollow in the center of the wrist at the crease. It also relieves wrist tendinitis, rheumatism, and wrist pain. The last point is triple heater 5, located on the outside of the forearm opposite pericardium 6, midway between the two bones below the wrist crease. It relieves wrist pain, rheumatism, and tendinitis. For further pain relief, apply two devices as demonstrated here. For back discomfort and pain, place the MVT on bladder 23, located at the second vertebrae and third vertebrae, 2 finger breadths to 4 finger widths away from the spine at waist level. This relieves lower backaches, sciatica, and fatigue from the pain. The next point is bladder 48, located 1 to 2 finger widths outside the sacrum and midway between the top of the hip bone and the base of the buttock. This relieves lower backaches, sciatica, pelvic pain, hip pain, and tension. Next, apply MVT to conception vessel 6, located 2 finger widths directly below the belly button. This relieves lower back weakness, improves weak abdominal muscles, and prevents a variety of lower back problems. Then apply to the umbilical area for added back relief. Next, apply MVT to bladder 54, located in the center of the back of the knee at the crease. Then go to gallbladder 30. This is a special trigger point to relieve back pain, sciatica, knee pain, back stiffness, and arthritis in the knees, back, and hips. The next point is gallbladder 34, located on the outside of the lower leg in a depression in front of and slightly below the head of the fibula. It relieves low back pain, leg pain, sciatica, and knee pain. This demonstrates how two devices may be used to help relieve lower back pain. To relieve knee discomfort and pain, start by placing the MVT on bladder 54, located in the center of the back of the knee crease. Then place the MVT on gallbladder 34. The next point is liver 8, located on the inside of the knee, where the crease ends when the knee is bent. This relieves knee and leg pain, back pain, and swelling in the knee. The next point is kidney 10, on the inner edge of the knee crease in the hollow between the two tendons. This relieves knee pain, genital disorders, and abdominal pain. Extra points around the kneecap and the application of two devices are shown for added relief. Next, place the MBT on bladder 53, which is located on the back of the knee on the outside crease when the knee is bent. This relieves knee pain and stiffness. The next point is stomach 35, located just below the kneecap in the outer indentation. This relieves knee pain and stiffness, rheumatism of the feet, and edema. Next, place the MBT on stomach 36, which is located 4 finger breadths below the kneecap and 1 finger breadth outside of the shin bone. This strengthens the whole body, tones the muscles, aids digestion, relieves stomach disorders, knee pain, and shin splints. For foot and ankle discomfort, place the MBT on kidney 3, located in the hollow depression midway between the protrusion of the inside ankle bone and the Achilles tendon. The next point is kidney 6, located 1 thumb width below the inside of the ankle bone. It relieves swollen ankles as well as ankle and heel pain. The next point is bladder 60, located opposite kidney 3 in the hollow between the outer ankle bone and the Achilles tendon. This relieves ankle pain, swollen feet, thigh pain, foot rheumatism, and lower back pain. The next point is bladder 62, located opposite kidney 6 in the indentation directly below the outer ankle bone. This point is also used for insomnia. The next point is gallbladder 40, found in a large hollow directly in front of the outer ankle bone. It relieves ankle sprains, toe cramps, and sciatica running down the outside of the foot. This next section demonstrates how to use 2 MBT devices to help relieve pain of the foot. You may also apply the MBT device to each of the toes, as demonstrated here, for further pain relief and to stimulate energy. In this last section, we are showing how the patient may be able to apply the MBT device on their own with instructions from their healthcare professional.